Hey guys, welcome to another episode of The Future of Health. Today I'm at the headquarters of Cardiogram and I'm about to meet one of the co-founders, Johnson Hsieh. Let's go meet him. Hey Johnson.
Oh hey Maria, you're here.
Yeah, how's it going?
I'm doing well, thanks for coming by.
Say hi to our audience today.
Hey Voxel Studio viewers.
What is Cardiogram?
So Cardiogram transforms consumer wearables like the Apple Watch into a medical device.
And how does it do it?
So we use machine learning to analyze heart rate data. And so far we're able to detect 4 medical conditions. And these are things like sleep apnea, high blood pressure, atrial fibrillation, and even things like diabetes.
And how can you use heart rate variability to detect these conditions?
So the answer is the autonomic nervous system. So it is consisted of the parasympathetic nervous system and the sympathetic nervous system. When your body is under stress, the sympathetic nervous system gets activated and your beat-to-beat variations actually become more stable. And when your body is relaxed, your parasympathetic nervous system is activated and the B2B variations actually becomes more variable.
Okay, so Cardiogram basically, like through machine learning, can see these different patterns and then I guess based on heart rate variability decide, okay, this heart rate variability pattern looks like hypertension or looks like diabetes. Is that right?
Yes, exactly. So there has actually been literature in the last 10 years or so using ECG and medical grade devices to detect similar conditions. So Cardiogram is the first company that uses consumer wearables and the PPG sensors to detect these conditions.
So it's really unique. Like nobody else is using consumer wearables right now to like analyze heart rate variability and help people kind of identify these conditions?
So Cardiogram is the first one that has able to prove success, and we have published medical literature on our clinical research and our validations. There are other companies now that, like the big wearable manufacturers, that are spinning off their own type of research in this area. But yes, Cardiogram is the first one.
I kind of understand how Cardiogram can identify, hypertension or atrial fibrillation, but how does it identify diabetes and sleep apnea?
The answer goes back to the autonomic nervous system, and it is basically the nervous system that connects your brain to your heart and many of your internal organs, including the pancreas. So for diabetes, for example, pancreas is the organ that secretes insulin, which regulates your blood sugar levels. When you have diabetes, your body is generally under stress, and that stress can be picked up using by your heart through heart rate variability.
Who is Cardiogram for?
Cardiogram is for everyone.
Okay.
Anybody can download Cardiogram for free on the Apple App Store and the Google Play Store.
Currently, what devices, wearables, is Cardiogram compatible with?
We're compatible with the Apple Watch, many different types of Android Wear devices, the Garmin device, and basically any device that writes heart rate data into the Apple Health app and the Google Fit.
Are you looking to integrate with more devices?
Yes, so that is on the roadmap. So we are planning to integrate with Fitbit, Samsung, Xiaomi, and basically any wearable that has a heart rate sensor and can export heart rate data. So there are other type of form factors that we're pretty excited about. So there are companies like the Oura Ring and the Motive Ring that's out there. There's also the rumored AirPods or headphones that have heart rate sensors on them. In the long run, we are aiming to be compatible with all of these devices.
I know that Cardiogram, you recently launched a few new features. So what are they and what do they do?
After we detect that you may have a condition, we don't just stop there. We actually will help you confirm your diagnosis by offering the user to give them a medical device that they can take the test at the comfort of their own home.
And I guess the benefit of this sort of continuous health monitoring, right, that cardiogram enables is that, for example, a lot of cardiovascular conditions are actually episodic, so you might not be noticing them, or so it's actually really beneficial to have something that continuously monitors the heart rate.
Yes, definitely. So a lot of users use our app on a continuous basis, and they check it multiple times a day, especially when they kind of feel symptoms. Sometimes it's not very clear, whether or not the symptom is actually due to a heart condition or not. So having objective data that they can kind of open up cardiogram and see if their heart rate is elevated or there's any interesting patterns, that really helps them manage their condition.
Cardiogram recently rolled out a few new features. What are they?
We recently rolled out 2 new features. One of them is share with family member, and the other one is share with doctor.
So what's the use case of share with family?
So the anecdote that we've been hearing is that when someone in your family have a medical condition, the people that will really take care of them and care about their progress is the family members. So we built this feature to allow a family member to remotely monitor your health, and they can even receive notifications if there are any spikes in heart rate, so that they can just remotely monitor you.
Okay, that's awesome. So it's like for my grandma, for example, I can give like a cardiogram compatible device, and she can choose to share the data with me, and I guess I could sort of help her monitor her health. Is that right?
Yes, yeah, definitely. Yeah, a lot of the kind of use case is a elderly parent and a adult child.
Okay, fabulous.
Yeah.
And so the other feature then, how does that work? What is it about?
Yeah, so that's the share with doctor. And so before we build the feature, a lot of users actually just go into their doctor's office and show the doctor what's on the iPhone.
Okay.
And they just open up Cardiogram and they kind of show it to the doctor. And the reason for this is that a lot of heart conditions are episodic. So when you are at the doctor's office, you may not be in an episode of the heart condition. And so a lot of times it creates an interesting dynamic of the doctor not really necessarily believing you, and you kind of feel like you need some sort of proof to show.
And that, I guess, where it comes in handy, that cardiogram is kind of continuously monitoring your heart rate, correct?
Yes.
And is able to sort of identify and catch certain things that otherwise go unnoticed or are not recorded otherwise.
Yes, exactly. It's really nice that we now allow users to kind of print out a PDF of their data over time. And so instead of kind of opening up the app, they can have these actual paper reports that they can go through kind of their history of heart rates over the last couple of weeks or months with your doctor.
So let's say that cardiogram identifies someone at risk for sleep apnea. What happens next?
So within the app, we will give the user an offer to receive an at-home sleep test. The user just has to enter their shipping address, and we will handle all the logistics of sending the at-home sleep test to the user's home. And then so the user can take it at home, and then we'll get the results back.
That's so useful because a lot of sleep apnea just goes undiagnosed.
Right, yeah. And then so after the user takes the test, we will show the result within the Cardiogram app. And then if the result is actually a confirmed diagnosis, we will recommend the user to go see their primary care physician or a sleep specialist for additional follow-ups. The really nice thing about this workflow is that the at-home sleep test is something that doctors are already very familiar with, so that when the user comes in with the report, the doctor can kind of operate right away. So in effect, we kind of plug in to the existing healthcare system.
So what happens if somebody is identified as at risk for hypertension, for example?
It's very similar. So we will give the user an offer to receive a blood pressure cuff. The user has to enter their shipping address, and we handle all the logistics of sending the device to the user's home.
Okay, wow, super convenient.
Yes, yeah.
You really don't have to do anything. everything, right? Especially if you already have a wearable, just download Cardiogram and off you go. You're continuously monitoring your health just in case if there's something, right?
Yes. Yeah, so the really nice thing is that it really reduces the friction of engaging in the healthcare system. A lot of times, in early stages of sleep apnea or hypertension or some of these other conditions, it's not really clear to the user or the patient whether or not they in fact do have the condition. And so even if they feel some sort of pain, they may not go to the doctors until something is seriously wrong. With Cardiogram and Cardiogram Care, we can really change that and kind of reduce that friction and get people to a confirmed diagnosis earlier.
Okay, great. So looking ahead, what's the vision for Cardiogram? What's next?
Yeah, so our mission is to reinvent preventive medicine by Cardiogram Care and by detecting these conditions earlier. And in effect, we can prevent a lot of downstream medical complications, reduce pain from these patients, and also reduce medical spend.
Johnson, thank you so much for coming on the show today. I really enjoyed learning more about Cardiogram.
Thank you for having me. It was a lot of fun talking with you.
That's it for today's episode. I hope you liked learning about Cardiogram as much as I did. And if you liked this video, make sure to give it a thumbs up. And for more content like this, do make sure to also subscribe to the Voxel Studios YouTube channel. I hope to see you next time. Bye, guys. If we look at my Cardiogram today, like Cardiogram is like, woo.
Alert.